As Eamon has presented, the global HIV response has faced an unprecedented shock in 2025, and the drastic cuts have been a stark reminder of our collective vulnerability. Here in Asia Pacific, our own program have also been affected, but I would like also to highlight that we show a very remarkable resilience. So I would like to commend very swift action by countries and communities to maintain essential services despite all these challenges. In this new era, the aid replenishment of the Global Fund that happened last week in Johannesburg is amounting $11.8 billion and is a very powerful testament to the continued global solidarity. And we expect more pledges to come before we announce the next country allocation in February next year. So we would like here to thank deeply all our donors who've already pledged and reconfirmed their determination to end AIDS as a public health threat and underscore the importance of global solidarity in fighting the world health deadliest diseases. Our mission of the Global Fund for 2023-28 strategy remains the same, but we need to make bold choices ahead of the current crisis and the expected reduced funding. And those choices should help us to remain fit for purpose. So our strategy remains in line with the board decision that is putting communities first, right, and center at the heart of the response. But also, what I think we need to note here is that as part of our strategy, the Global Fund board decision in November took a decision for our commission that increased the focus on life-saving services and strengthening collaboration with community to those most vulnerable by supporting countries with the lowest income and the highest disease burden, and doubling down effort on driving self-reliance and durable system. So what does it mean? The current allocation for the so-called grant cycle 7 overall globally is $13 billion. That includes $800 million for HIV in Asia Pacific region. But this means that country, based on the board decision to focus on the poorest countries with the highest burden, means that for middle income range countries, the next allocation will be reduced even further. So we need to anticipate that many countries in Asia Pacific, with the reduced allocation, with the reduced pledges that we anticipate, and the board decision on focusing on country economical curve means that those countries in this region, middle income, will get reduced allocation from the Global Fund. Countries want to and should lead. So all of us, as partner, we must incentivize support and ultimately getting out of the way as external funders. So for our region, this resource that we have now will allow us to do several things. First of all, it will be about protecting our gains and preventing backsliding, especially in reaching key population who account for the vast majority of the new infection in the region, as was reminded earlier. And in this environment of constrained resource, our investment will become even more data strategic driven. So we should focus intensively on the geographical area and population where we can have the greatest impact on the epidemic. We recognize that in this region, key population face stigma and discrimination and legal barriers, and community-led organizations are the bedrock of an effective response. Our support will prioritize strengthening their capacity and ensuring that they have sustainable pathway.